Assalamu alaikum. My name is Dr. Abdullah Shfaq. As you know, I recently passed PLAB 2 exam and I have uploaded the videos of how to pass PLAB 2 exam, everything that I have done regarding the guidelines, and I also uploaded the video about the clinical attachment. You can watch my videos on my YouTube channel and kindly subscribe to my channel and recommend others because during the whole PLAB 2 journey, the guidance is very important. It's a crucial element if you want to pass your exam first attempt. So today I'm going to share my experience regarding ALS, which is Adult Life Support course I have done from the Resuscitation Council UK. So most of the PLAB aspirants when go to the UK, they have a plan to do the observership. They have a plan to do a PLAB 2, and they also have a plan to do an ALS as well. So today I'm going to discuss all the things which you need to know about the ALS. So first of all, it is a ALS is a workshop, is an exam as well. Is an exam as well. You have to pass ALS. It is adult life support. You as a doctor, you know many of the courses we have to do like BLS, ALS, ILS, pediatric ALS. So it's adult life support program and it's a certification actually. So first of all, you need to know that how to book ALS and when to book ALS. So first of all, many of the PLAB aspirants ask questions regarding when to book the ALS. So what I recommend you is that if you have a money, if you have a financially strong background, then you can book the ALS before going to the UK. But what I have done, and most of the students uh, will do that they book ALS after passing the PLAB exam because this certification improves your CV. So first of all, you have to pass your exam, then you have to do the other things which will improve your CV in getting the job. So clinical attachment and ALS, both things will improve your CV. So what I recommend is to book ALS after passing your PLAB exam when you are doing the observership or clinical attachment, and the same thing I have done during my whole journey. So, but the thing is, which you need to know is that there is some advantage if you book ALS before going to the UK. So if you book ALS before at least 3 to 4 months before going to the UK or before or during or you, before your expected result date, so you can get the seat on a cheaper rates. So so the price range varies from 300 to 700 pounds, which is very important thing. Many of the doctors don't know these things. Like the price range of ALS varies from 300 to 700 pounds. But if you want to do a cheaper, but if you want to do ALS on a cheaper rate, then you have to book earlier, like 3 to 4 months. Otherwise, during the 1 month, you will not get the seat on a cheaper rate. So if you want to book an ALS after passing your exam, which is the safest side, but then the disadvantage is that you need to pay higher amount. Like you can get 500 pounds ALS, you can get ALS for 600 pounds. So it varies from centers to centers. So how to book? Now the question arises: how to book ALS? So there is a website. I will give a link in the description, which is Resuscitation Council UK. So you can go to the website, and there are many centers available on that website. So you can choose according to your requirement on the day you want to do, and on the location you want to do. So you can search, like if you want to do Manchester and on that specific time duration, you can search there and you will see all the centers which are offering ALS during that time period, and you have to pick the mail. So the most important thing is that you have to pick the email of the center from the Resuscitation Council website, and you have to email about your interest in the ALS program, and then they will email back you all the details, and then you will book the ALS from their website. So this is the process for the booking of the ALS. So the price range varies from 300 to 700 pounds. You can find the ALS for 400 pounds, 500 pounds, 600 pounds, like that. It varies from center to center. Uh, the most important thing is that there are two types of ALS. One is EALS, in which there is only 1 day workshop, and the other is ALS, in which you have to attend 2 days workshop. So what's the differences? I have done EALS. In both the things, most of the things are same, but the time duration, as I told you, that in ALS you have to attend 2 days workshop. In EALS you have to attend 1 day workshop, and on the same day you have to give your exam as well. So first of all, I would recommend you that how to start after booking, how to start preparation after booking. So, first of all, if you book EALS, it is cheaper than ALS. That's the important thing. So, what you have to do when you book your ALS exam, ALS course, so they will send you a manual, which is a book you have to study. You have to study for your exam, for your ALS. So they will send you a manual at least 1 month before your exam date, which you have booked. So after this, the time duration for the preparation of the ALS is approximately 2 weeks. So 2 weeks you can pass your exam, but you have to study at least 3 to 4 hours, 2 to 3 hours a day. It's not as difficult, but it's not as easy. So you don't go for the exam blindly without studying anything. Otherwise, you will not pass. So, what things you have to study? There are many things that you can do before appearing in your ALS exam. So first of all, when they will send you a manual at least 2 weeks before your exam, start studying and go through the manual superficially. Don't need to study in detail that manual. It's a book of 200 to 250 pages, but the important thing in the manual is the algorithms. You will see when you get your manual, there are algorithms in each chapter. You have to study. You have to study. You have to be focused on the algorithms. And regarding your MCQs, there is a website. I will share the link on the description. You can study and then you can do the MCQs from the website, because these websites have the past papers of the ALS. It will also help in your exam. So after the 2 weeks, when you complete your manual thoroughly, and when you will practice the MCQs on the when you will do the MCQs on the website that I have shared in the on the description, and on the when you go to the workshop. So regarding the exam, first of all, regarding the exam, there are two parts of the exam. One is the MCQ space, and the other is the clinical part, practical station part. So there are 30 MCQs for the ALS, and each MCQs contain 4 parts, and you have to pick the 4 part, and the 4 parts of that statement, which is one MCQs, is also a correct or false. So you have to pick the statement like it is a correct or not. So it is a true or false just. It's not a multiple choice that you have to pick four options. You have to pick one option from the four options, out of the four options. So it is a true or false actually. So there is a one statement given, and the four options are given below that statement, related to that statement, and you have to pick the all the four option is either true or false. So it depends. So so these are the 30 MCQs, and each MCQs consist of four parts. So actually there are 120 MCQs. So you have to pass these MCQs 75%. You have to gain 75% marks if in order to pass the written part of the ALS. And when you will pass the ALS, then you will appear in the practical part. So if you unfortunately if you fail unfortunately the written part, so you have to appear in the exam during the 3 months. Otherwise you will not get your certification. And if you fail on the practical part, they will give you another chance on the same day. And if you fail on the second attempt, then you will have to reappear during the 3 months. So this is how the ALS works. And regarding the EALS and ALS, on the if I talk about the ALS, it is a 2 day workshop, and on the 2 days they will keep studying. They will teach you each and everything. They will tell you about how to practice, how to perform ALS, how to give advanced life support to the patient, and at the end of 2 days they will give your exam. If I talk about the EALS, they will send you the some e-learning courses or modules. Like I have done the EALS, they have sent us 12 to 13 modules on the Resuscitation Council website. So when you booked your ALS, they will assess you. When you book your ALS, they will make your account on the Resuscitation Council website, and they will give you access to the courses which are modules, and you have to do the modules. It is a 40 to 45 minute module, and all the modules are topic wise. So in each module there are some videos, some MCQs, some quiz, and some detail of the topics. So you have to study these modules, you have to complete these modules, and you have to do pre-test MCQs before going to the exam day or workshop day. So these 9 to 10 modules you have to do before your exam, and on the exam day they will teach you about the practical station part, about the clinical part, how to resuscitate the patient if the patient got collapsed. And at the end of the day they will take your exam. So first of all they will take the MCQs part, and after the practical part. And you can it is like ABCDE approach, as we have done in the Simon part of the PLAB 2. And and then suddenly the patient got collapsed, and you have to do the resuscitation. Like you have to assess the patient, and you have to do the CPR, and you have to give the shock if it is a shock algorithm. So you will learn each and everything on that day, and you have to appear on the exam. So, and when you will pass both the parts, and then they will email you a certificate of your ALS. So this is all about the ALS part of the PLAB2 journey. So it's not as tough, and it's not as easy. So you have to study for the ALS as well. And it is nowadays requirement for some jobs, and for the to improve your CV as well. So if you have any queries, you can ask me at any time in the comment section, or you can join my WhatsApp group given in the description. So this is all about ALS, and I wish all of you best of luck who are going to appear on the PLAB exam, and who are studying for the ALS as well. So thank you. Allah Hafiz.